Greetings of peace. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good morning to each and everyone. So for this video, we will start our discussion on major mental disorders or mental illnesses. Okay, so we have here the different learning objectives for this unit. Identify major categories of mental disorders, identify types of disorders under each category, understand the basic characteristics of each disorder, and to recognize examples relevant to nursing practice. So now let's define first, what do you mean by mental disorder or mental illness? Now, mental disorders are conditions that affect a person's thinking, emotions, behavior, and ability to function in daily life. In psychiatric nursing, understanding the types of mental disorders, their characteristics, and examples helps nurses recognize symptoms and provide appropriate care. So, if we were to use the two terms mental illness and mental disorders, it has actually the same idea, okay? It has the same definition. However, in formality and for clinical terms, we use the term mental disorder. Again, mental disorder is the formal and clinical term used in diagnosis. So this refers to a defined condition with a specific criteria based on the DSM-5, okay? So, it is used usually by healthcare professionals for assessment and classification. So, again, we use mental disorders and mental illness in the same manner because they have the same definition. However, in the clinical setting, we use the term mental disorder. So, mental illness is more on a broader and a general term. It is commonly used in everyday language, which refers to any condition that affects the mental health. Okay? So, what are the different classification of these mental illnesses or mental disorders? So first, we have here the mood disorder, or also known as your affective disorders. This is characterized by extreme sadness or elation or fluctuating feelings of mild to extreme periods of extreme happiness to extreme sadness. So this includes, the mood disorder includes your bipolar disorder or your major depression or your mania. So later on, we will discuss it one by one. Another classification of mental illness or mental disorder, we have your thought disorders. Now, this is characterized by distorted thinking and sensory perception. So again, the problem here is the thinking and the sensory perception. What are what they call this? How we perceive different senses or stimuli from our environment, such as hallucination, delusions, illusions, which includes this type of disorders. This includes here your schizophrenia, because the schizophrenic patients can experience hallucinations, delusions, and illusions. So we have here another classification. We have your anxiety disorder. So from the word anxiety, meaning, what they call this, uneasiness, okay, feeling of uneasiness, okay, characterized by response to excessive and uncontrollable fear, dread, anxiety, or nervousness to certain situations or objects. This may include your general anxiety disorder. We have your PTSD or post-traumatic syndrome. Okay, we have your obsessive compulsive disorder, your phobias and panic disorder. Another is we have your personality disorders. Now here, it is characterized by extreme, rigid, and inflexible personality traits and maladaptive patterns of behavior and thinking. This may include antisocial behavior, obsessive compulsive, paranoid or paranoia, borderline histrionic personality disorder. And last but not the least, the last The fifth, sorry, not the last, but the fifth characteristic or classification, sorry, of mental disorders, we have your eating disorders. So from the word eating, there's a problem with diet or nutrition. This is characterized by abnormal attitudes, emotions, and behaviors towards food and weight. This includes your anorexia nervosa and bulimia nervosa. For the sixth classification of mental illnesses or mental disorders, we have your cognitive disorders. This from the word cognitive. This disorders includes those problems and cognition or ability to think. Okay, this includes your Alzheimer's disease. Now, for your developmental disorders, these types of disorders includes problems in the developmental progress or the development of a specific child or an individual. So we have mental retardation or ADHD or attention deficit hyperactivity disorder. Another, we have your substance related disorder. So this includes all the disorders that uses any substances that could deprive or that could decline the process of your brain, which includes alcohol or drugs. And then we have your somatoform disorders. This is characterized by presence of physical symptoms without medical cause. So this includes conversion disorder. So this type of disorders, so the patient can feel different symptoms. There is a, what they call this? There is a presentation of illness. However, there is no medical cause. Okay? And last but not the least is your sexual and gender disorders. So this is characterized by abnormalities in sexual desire, performance, and behaviors, which may include sexual dysfunction, gender identity disorders, or even paraphilias, or any yung mga obsessions nila, obsessions in or certain objects that they obsessed during having sexual intercourse with other person. Okay, so now let's talk about the populations who are at risk in developing these different classifications of mental disorders or mental illness. So we have familial or genetic predisposition, especially to those who has a family member that experienced this or that had mental disorders. We have poor access to healthcare, homeless, and poor, okay, substance abuse or misuse of any substances, undergoing lifestyle changes, victims of violence, especially any types of violence, physical abuse, okay, mental abuse, psychological abuse. This can put the patient or a population at risk of having mental disorders or mental illness. And lastly, those who are elderly or poor. So usually, as you can see here, the very common characteristic of this people or population at risk is usually those who are vulnerable. Okay? Vulnerable for abuse or violence are women, okay, and elderly. So those who experience that kind of abuse, those who has experiences or episodes of problems or stress in lives, no, wherein the person cannot really manage and move on with that kind of stress, then they may have put themselves at risk of having mental disorder. So now let's identify and let's discuss each one of those classifications of mental disorder. So again, we have first your mood disorders, or also known as your affective disorder. So these are characterized by disturbances in a person's emotional state where mood may shift from extreme sadness or your depression or to extreme happiness or elevated mood, or what they call manic phase or mania. Okay? So, what are the different types of your mood disorders? We have first the major depressive disorder. This is characterized by a persistent sadness, loss of interest in activities, fatigue, and feelings of hopelessness. So, it is, we have here different symptoms of patient who experience major depressive disorder, we have um sorry, persistent sadness, fatigue, loss of appetite, insomnia or hypersomnia, feelings of worthlessness, and even suicidal ideation. So, if a person who can experience this persistent feelings of sadness for at least 2 weeks, they have to go to a healthcare provider to have their follow-ups, because within this time frame, maybe the patient will have an idea to kill, or end his or her life. So another type of mood disorder is your bipolar disorder. So this is characterized by alternating episodes of depression and mania. So that's a combination of the extreme sadness and extreme happiness. Okay? So this has different types: the bipolar 1, bipolar 2, and your cyclothymic disorder. So bipolar 1 is it has a severe manic episodes with or without depression. Bipolar 2 has hypomania, not so, and not the extreme happiness na state, but with major depressive episodes. While your cyclothymic disorder, it is mild but chronic mood fluctuation. So, up and down yung kanyang moods or mood swings. Okay? Now, what are the clinical major manifestations of your major depressive disorder? Again, persistent sadness or empty mood, anhedonia or loss of interest in activities, fatigue, low energy, any sleep disturbances, either hypersomnia or insomnia. We have appetite changes, either weight loss or weight gain, depending on the effect on a certain person. We have feelings of worthlessness or guilt, and poor concentration. So if the patient can experience or has suicidal ideation, it should be prioritized by the nurse. Okay? It is very crucial that you have to identify or to assess the feelings of the patient, because if the patient has this kind of idea, then he or she may have or may impose harm to himself. Okay? So what are the medical management for these patients? Okay, so they can take antidepressants. So if you can still remember, with the psychopharmacology, one of the medications that could improve the mood of patients who have mood disorders is your antidepressants. So, antidepressants may include your SSRI or selective serotonin reuptake inhibitors, your TCAs or tricyclic acids, and then SNRIs. And then we have also for your psychotherapy, they may be having your cognitive behavioral therapy. We have your electroconvulsive therapy for severe or suicidal patients. So nursing management may include assess suicide risk first. That is the priority intervention. Again, you have to assess if there is a suicidal ideation for those person who experiences major depressive disorder. And then establish therapeutic communication, encourage expression of feelings, promote self-care and hygiene, monitor medication compliance and side effects, and provide safety environment, especially to those patients who has suicidal ideation. You will have to remove all things that could cause harm to the patient. So another type of your mood disorder, we have your bipolar. So again, we have this clinical manifestations includes mania or the elevated irritable mood, increased energy, decreased need for sleep, grandiosity, rapid speech, or patient may have or may experience flight of ideas, impulsivity in spending or risky behavior. For depression, same as MDD, no? They will be having suicidal ideations, feeling of super sad, okay? So this is just the same with your MDD. Now, what are the medical management for patients who experience bipolar disorder? So they have to take mood stabilizers such as lithium, which is a gold standard for patients who has bipolar disorder. We have antipsychotic drugs or when we say antipsychotics, these are anti-anxiety drugs. We have, what do you call this? Antipsychotic disorders drugs, or those this may decline the hyperactivity of the brain. And then we have antidepressant, but you need to be cautious because again, there is a type of bipolar disorder that the patient may not experience that too much state of depression, okay, or the patient is not experiencing any depression at all. So nursing management may include during mania, you have to set firm and clear limits. You have to reduce environmental stimuli because they are at what they call this, at extreme happiness. So they are overstimulated. Okay. Ensure nutrition, monitor lithium toxicity, such as if there's a presence of tremors, diarrhea, confusion, you have to stop the medication. And then promote sleep and rest. So now let's talk about the thought disorder. So if the mood disorder affects the affect or mood of the patient, now this one, in thought disorder, this involves disturbances in thinking and perception. So common symptoms may include hallucinations, delusions, or even disorganized thinking. So what are the different types of thought disorders? So first, we have your schizophrenia. So schizophrenia is a severe psychiatric disorder affecting the thought process, perception, emotions, and behavior. So symptoms include auditory hallucination. So they can hear voice without any stimuli. Okay? They are the only one who can hear those voices. Now, the problem with the auditory hallucinations, they can hear voices that may tell them that they have to kill themselves or they have to kill other people. So you have to be careful with this type of hallucination. Another, we have delusions, or they have false beliefs, such as they have grandeur delusions, wherein they feel that they thought that they are the president, or they own everything like that. Okay. We have disorganized speech and social withdrawal. So another type of thought disorder is your schizoaffective disorder. It is a combination of your schizophrenia symptoms and mood disorder symptoms. Okay? So what are the clinical manifestations of patient who has schizophrenia? So they have positive and negative symptoms. Positive symptoms may include hallucination. Auditory is the most common hallucinations of patient with schizophrenia. We have delusions. We have disorganized speech. While as for your negative symptoms, this includes flat affect, social withdrawal, and lack of motivation. Okay? So what are the management for patients who may experience schizophrenia? We have antipsychotic drugs, which may include typical or atypical antipsychotic drugs. We have haloperidol, risperidone, or clozapine. And then for your psychobehavioral therapy, we have your psychosocial therapy. So nursing management do not argue with delusions because they will not believe you. So instead, you let the patient verbalize their delusions, verbalize their feelings. You know what is real and what is not, but again, you have to respect their delusions. You may reiterate to the patient or you may reorient the patient. However, if the patient do not agree with your reorientation, then do not argue because you will, overstimulate the patient. Okay? Another, focused on reality orientation. Ensure safety, especially to those people who experiences auditory hallucinations or any type of hallucinations, visual, auditory. Okay? And then build trust, encourage social interactions gradually, and monitor for any extrapyramidal side effects or your EPS. Okay? And then for your different types of schizophrenia, we have the traditional classification. We have paranoid schizophrenia. We have your disorganized schizophrenia, we have your catatonic schizophrenia, undifferentiated schizophrenia, and we have your residual schizophrenia. So let's discuss it one by one. For your paranoid schizophrenia, characteristics may include prominent delusions, okay, auditory hallucinations, and suspiciousness. So they feel that someone is after their lives, and then they are trying to be killed by other people. So these are examples of those paranoid schizophrenic. And then we have disorganized schizophrenia. Characteristics may include disorganized speech, inappropriate emotional responses, and difficulty performing daily activities. For your catatonic schizophrenia, so characteristics may include abnormal motor behavior, immobility or excessive movement, or lack of response to external stimuli. For your undifferentiated schizophrenia, characteristics may include this from the word undifferentiated. The symptoms that the patient may experience here do not fit to any other types of schizophrenia or other subtypes. And last but not the least is the residual schizophrenia. So these characteristics may include history of schizophrenia and mild or remaining symptoms such as social withdrawal. So these are the different or traditional classifications of your schizophrenia. Now, let's talk about anxiety disorder. So we're finished with your mood disorders, which includes your major depressive disorder and your bipolar. And then we have your thought disorders, the schizophrenia and schizoaffective disorder. Now, let's talk about anxiety disorders. Okay? These disorders are characterized by excessive and uncontrollable fear or worry, or the feeling of uneasiness. The anxiety interferes with daily functioning. So they are characterized by excessive fear, worry, and nervousness that interfere with daily functioning. So actually, anxiety is a normal response to stress. However, it becomes a disorder when it is persistent, excessive, and uncontrollable. Because we have here actually in anxiety, we have different levels: mild, moderate, severe, and the panic. So mild and moderate is okay because it actually helps us to respond to stress, to build or to look for any solutions, especially if we are under stress. However, when we are in the stage of severe and panic, then we cannot think. Okay, our thought process will be change. No, we're not capable of thinking straight. We're not capable of making decisions in or we don't have a good decision making. Okay, so common symptoms of anxiety disorder may include restlessness, palpitations, shortness of breath, excessive worry, difficulties concentrating, and sleep disturbances. So what are the different types of anxiety disorder? So we have your generalized anxiety disorder, or your GAD. So we have panic disorder, we have your phobias, we have your obsessive compulsive disorder, your OCD, and we have your post-traumatic stress disorder. So let's define first the GAD, or generalized anxiety disorder. So it is a persistent and excessive worry about everyday situations. So example, a patient constantly worries about health, finances, and family safety even without a real danger. Another type of anxiety disorder is your panic disorder. Let's talk about recurrent panic attacks involving sudden intense fear. Symptoms may include palpitations, shortness of breath, dizziness, and fear of dying. Now, for your phobias, these are irrational fear of specific objects or situations. Types There are many types of phobias, but these are just example. We have specific phobia, we have social phobia, and we have your agoraphobia. This specific phobia has different subtypes, such as fear of what they call this, fear of spiders, fear of heights, fear of closed spaces. These are specific phobia. So there's a specific object or specific what they call this, animal or anything that you have fear against with. Okay, we have your social phobia. This are type of phobia that wherein a person is having fear of socializing or integrating themselves in their environment. Okay, for your another type of anxiety disorder, we have your obsessive compulsive disorder, or characterized by obsession or intrusive thoughts and compulsions or repetitive behaviors. The next type of your um the next type of your anxiety disorder is the post-traumatic stress disorders. So this occurs after experiencing a traumatic event such as accidents, violence, and even disaster. So, example, if you have experienced loss of a family member, or someone was killed, or you have experienced rape or fire or any accident, no, that may lead to a anxiety disorder. Okay, so what are the clinical manifestation of these different types of anxiety disorder? So again, for your generalized anxiety disorder, we have excessive worry, restlessness, muscle tension, and fatigue, and even difficulty in concentrating. For your panic disorder, we have sudden intense fear, palpitations, shortness of breath, chest pain, and even fear of dying. For OCD, we have obsessions, which is your intrusive thoughts, and compulsions is the repetitive behaviors. As for your PTSD, we have flashbacks, nightmares, hypervigilance, and avoidance. Now, what are the different management for different types of disorder or anxiety disorder? For the medical management for GAD or generalized anxiety disorder, they have to take, they can be, or they're allowed to take SSRI or selective serotonin reuptake inhibitors. We have your benzodiazepines. For nursing management, you have to provide calm environment and teach relaxation techniques and encourage verbalization of fears. Now, for your panic disorder, they have the same management with your GAD, benzodiazepines, and SSRI. So nursing management may include stay with patient during attack, especially if they are experiencing panic attacks. Use calm and reassuring voice and encourage slow breathing. For OCD, SRIs or such as cognitive behavioral therapy or exposure and response prevention. Okay, so you expose the patient to the specific what they call this, obsession, such as example, obsessed with doing hand washing because they have fear of touching any microorganisms, okay, or they're obsessed in cleaning their clothes. So you have to expose them gradually to prevent those repetitive actions. And then we have nursing management. Do not stop rituals abruptly. So, gradual yung changes. And then, gradually limit behavior and provide structured routine. For the PTSD, they may take SSRI or trauma, or they may undergo trauma-focused therapy. Ensure safe environment, encourage expressions of trauma, and avoid triggering stimuli, especially to those victims of violence. Okay? Now, let's talk about personality disorder. So the fourth classification of mental illness. Now, personality disorder is characterized by rigid and maladaptive patterns of thinking, behavior, and relationship. While these patterns are long-lasting and affect the social and occupational functioning. So again, personality disorders are persistent patterns of behavior, thinking, and emotional response that significantly deviate from societal expectations. They are usually grouped into three clusters. So your personality disorder is usually grouped into three clusters. We have the paranoid cluster A, the cluster B, and the cluster C. So these are the three different clusters. So the cluster A is the odd eccentric disorders. So this includes your paranoid personality disorder. We have your schizoid personality disorder. We have your schizotypal personality disorder. So, paranoid personality disorder, this has a patient who is full of distrust and suspicion of others. Schizoid personality disorder, they has or patient who has detachment from social relationships and limited emotional expression. For your schizotypal personality disorder, these are individuals who has odd beliefs or unusual behavior and has social anxiety. Okay? For the medical management of cluster A, personality disorders. So there's no specific medication to cure personality disorders. However, the treatment actually in the medical management is focused on palliative or improving the well-being of the patient by stopping or by decreasing the symptoms that the patient may have experienced. So we have antipsychotics for paranoid ideation or severe perceptual distortion. We have antidepressants if comorbid depression or anxiety is present. So the primary treatment for patients who are experiencing personality disorder is actually psychotherapy. So they may undergo supportive therapy, cognitive behavioral therapy, and even social skills training. So nursing management may include establish trust slowly, especially to those people who have paranoid personality disorder. Use clear, simple, and consistent communication. Avoid forcing interaction. Respect personal space. Encourage socializations gradually. Provide reality orientation if needed. Maintain a non-threatening, calm environment. Avoid challenging delusional beliefs directly. Instead, focused on the feelings of the patient. You have to respect their delusions, their feelings, okay? For the cluster B, we have the dramatic or emotional disorders. So we have different disorders that belongs to this cluster. So we have antisocial personality disorder, the one who disregards for others' rights and has lack of remorse. So these are person who kills everyone, okay, or anything, who doesn't feel any remorse from killing other people or for inflicting pain towards other people. So we have borderline personality disorder, one who has emotional instability, fear of abandonment, and impulsive behavior. Another type which belongs to cluster B is histrionic personality disorder, one who experiences excessive attention seeking and dramatic emotional expression. And then we have your narcissistic personality disorder, an individual who has grandiosity, which needs or he or she needs for admiration and lack of empathy. So what are the medical management or nursing management for patient who belongs to cluster B? So we have psychotherapy again. Again, there is no cure. There is no specific medication that is a cure for personality disorder because the problem here is the personality of that person. Now, what is the cornerstone treatment? Psychotherapy. So we have dialectical behavior therapy, we have your cognitive behavioral therapy, and mentalization-based therapy. So medications are used to manage symptoms such as your mood stabilizers for impulsivity and mood swings, antidepressants if the patient experience depression or anxiety, antipsychotics for episodes of aggression, severe mood instability, and anxiolytics for short-term use for acute anxiety. However, it should be used cautiously. Now, for nursing management, we have maintained consistent boundaries. This is very, very important, especially to those people who experiences antisocial personality disorder. You have to respect their boundaries. Avoid splitting behavior. The patient may idealize one staff and devalue another. Provide structure, environment, encourage expression of feelings using therapeutic communication. Monitor for any self-harm or suicidal ideation, especially to those who are in borderline personality disorder. And then monitor for any impulsive or aggressive behavior, especially to those people who are experiencing antisocial personality behavior. Do not reinforce manipulative behavior. Use limit setting techniques firmly but respectfully, and promote coping strategies and emotional regulation skills. Now, for your cluster C, your anxious or fearful disorders. So we have avoidant personality disorder, dependent personality disorder, and your obsessive compulsive personality disorder. So this is very different with the two, ha. Anxiety disorder na OCD is focused, or it is actually triggered by anxiety or by feeling of fear or anxiousness. Okay, here, and for the cluster C of personality disorder, one who is preoccupied with perfection and control. Okay, so the personality of those people who likes to control other people, who likes to be perfect. Okay, they have this obsession of perfecting everything that they do. Okay, so there's actually, they have the same characteristics, however there's a somewhat difference, because in OCD and anxiety disorder, or a type of anxiety disorder, this is actually can be treated for any medication. However, if for OCD, who are for personality disorder, they can only be treated with therapy mostly. Okay, for avoidant personality disorder, they have extreme social inhibition and who fears rejection. So have to be careful of talking or engaging yourself with this type of people, no? Dependent personality disorder, they has excessive need for reassurance and has difficulty making decisions. So they're very dependent to every or to other person. Okay. Again, for OCD, we have one who is preoccupied with perfection and control. So what are the medical management? Again, the primary therapy for personality disorder is psychotherapy, or CBT for maladaptive thought patterns, supportive therapy, and behavioral therapy. For medications for associated symptoms such as your antidepressants for anxiety and depression, and anxiolytics for any short-term relief of severe anxiety. So treatment focuses on improving self-esteem, decision-making, and independence. For the nursing management, provide a supportive and non-judgmental approach, encourage independence and decision-making, especially to those people who are or who has dependence personality disorder. We have avoid fostering dependency, help patient identify and express anxiety and fears, gradually build confidence and self-esteem, use positive reinforcement for adaptive behaviors, assist in developing problem solving and coping skills, and maintain patience as progress may be slow. So, again, for the personality disorder, the treatment for this one is more on therapy, more on having support behavioral therapy. Okay, you have to really allow the patient to express their feelings, and you have to respect their boundaries, because that is the type of personality they have. Now, they can change their personality, however, you have to be patient, because this takes a lot of time. Hindi not in one snap, they will change their behavior. So now let's talk about eating disorders. So again, these are types of disorders that involves abnormal attitudes, behaviors related to food, body weight, and body image. So this has two types. Okay, we have anorexia and your bulimia. So anorexia nervosa, they experience extreme restriction of food intake leading to severe weight loss. Why? Because they see themselves as too fat. Okay, but in reality, they are too thin. So a teenage girl refuses to eat because she believes she is overweight despite being underweight. So that is an anorexic symptom or characteristic. For bulimia nervosa, they have repeated episodes of binge eating. When you say binge eating, too much eating, they eat a lot of food, and then after that, they are followed by purging behavior, or they induce vomiting, okay, or excessive exercise, or taking medications that could cause increased bowel movement. Okay, so example, a person eats a large of food, then induces vomiting due to guilt. So what are the clinical manifestations of these two types of eating disorders? For anorexia nervosa, this includes extreme low body weight, intense fear of gaining weight, distorted body image because they perceive self as overweight, refusal to maintain normal weight, and amenorrhea or lack of menses for women who experience anorexia nervosa. For your physical signs may include cachexia or emaciation, dry skin, brittle hair and nails, lanugo for fine body hair. This is actually common na this can be seen for a baby, from a baby. But however, if the patient can experience that one, it's because of poor nutrition. And then we have cold intolerance, bradycardia, hypotension, fatigue and weakness and dizziness. For behavioral signs, you may see them to restricting their eating. They engage to excessive exercise. They have food rituals, calorie counting, and social withdrawal. For medical management, nutritional rehabilitation is a primary goal, so gradual weight restoration, high calorie and nutrition-rich diet. Monitor for refeeding syndrome, in which yung refeeding syndrome wherein you give lots of nutrients to the patient and then their body cannot tolerate it. So you have to monitor for that. So monitor for any electrolyte imbalances, especially phosphate. So correct the electrolyte imbalances, IV fluids if the patient is severely dehydrated. So medications may include antidepressants for comorbid depression or anxiety, and sometimes antipsychotics for any distorted thinking, especially again they perceive that they are too overweight. Okay, for nursing management, you have to establish a therapeutic non-judgmental relationship. Monitor daily weight, their vital signs, and intake and output. Implement strict meal supervision. You have to really observe the patient when eating and after eating. Do not leave the patient unattended if they are having their meal. Okay? So, observe them during and after meals to prevent purging or exercising. Set structured meal plans. Avoid negotiating or arguing about food. Encourage gradual weight gain. Monitor for complications such as electrolyte imbalances or cardiac issues. Because if the patient can experience electrolyte imbalances, they may experience cardiac issues such as problems in potassium, problems in calcium, and magnesium. And then we have provide positive reinforcement for compliance, educate about nutrition and health consequences, and address body image distortion using therapeutic communication. Now, for your bulimia nervosa, so we have clinical manifestation which includes recurrent binge eating episodes, compensatory behavior such as self-induced vomiting, misuse of laxative, diuretics or enemas, excessive exercise, or even fasting. So they may have normal or near normal body weight. So physical signs may include tooth enamel erosions, dental caries, parotid gland enlargement because of inducing vomiting. And then we have electrolyte imbalance, especially hypokalemia. So you have to be careful. You have to closely monitor the cardiac health of the patient, no? Esophageal irritation or rupture, which is very, very rare. However, this may occur. And then we have calluses on knuckles, or what we call Russell's sign, because of inducing vomiting. So psychological features may include guilt, shame after binging, depression and anxiety, and distorted body image. So what are the medical management? We have psychotherapy, such as cognitive behavioral therapy and your interpersonal therapy. Medications may include SSRI to reduce binging or binge purge behavior. Nutritional counseling, correction of electrolyte imbalances, especially potassium replacement, dental care for any enamel erosion, and hospitalization is ideal if the patient experiences severe electrolyte disturbances, suicidal ideations, and medical complications. For nursing management, you have to establish trust and rapport. Encourage regular eating patterns. So monitor for binging and purging behaviors after meals and electrolyte imbalance. Provide supervision after meals. Avoid confrontation. Use calm and supportive communication. Educate them on the effects of purging, such as if they purge, they may experience electrolyte imbalances or cardiac problems. So that is a more critical or more complicated case or complicated problem. And then we have importance of balanced nutrition. Assist in developing coping strategies and stress management techniques. Promote self-esteem and body acceptance. Reinforce non-weight based measures of self-worth, and maintain consistent boundaries. Okay, so now let's talk about cognitive disorders. Again, these types of disorders involves impairment in memory, thinking, and decision making. So the number one example or type of cognitive disorder that is very known in psychiatric nursing is your Alzheimer's disease. Now, Alzheimer's disease is different from dementia. Dementia is usually due to old age. However, Alzheimer's, it can be experienced starting from 30 years old down to the elder people. So as early as 30 years old can experience Alzheimer's disease. So it is a progressive brain disorder causing memory loss, confusion, personality changes, and difficulty performing daily activities. So we have here different signs and symptoms or clinical manifestations of your Alzheimer's disease. So memory loss, especially the recent or short-term memory. They can recall long-term memory. However, they cannot recall short-term or recent memory. Disorientation to time, place, and person. Difficulty with language, or in medical term, we have aphasia. And then impaired judgment and decision making. Difficulty performing familiar tasks, or what we call apraxia. And then we have a loss of ability to recognize objects or people, your agnosia. Now, for behavioral and psychological symptoms, this may include personality changes, agitation, irritability, depression and anxiety, hallucinations or delusions in late stage of Alzheimer's disease. We have wandering behavior. For physical or functional decline, they have difficulty with performing their daily activities of living. We have poor coordination and gait disturbance. We have incontinence, which is usually in late stage, and dysphagia or difficulty of swallowing in advanced stage na yun siya. Now, for medical management for Alzheimer's disease, we have cholinesterase inhibitors, which improves the cognitive function by increasing acetylcholine. Because the main problem here actually in Alzheimer's disease is your acetylcholine, your neurotransmitter acetylcholine. So we have your NMDA receptor agonist, which helps regulate glutamate and slow disease progression. So we have here management for behavioral symptoms such as yung medication antidepressants and antipsychotics, supportive and symptomatic treatment for nutritional support and treatment of comorbid conditions, and then cognitive stimulation therapy and structured activities to help maintain mental function and delay decline. For nursing management, we have ensure patient safety, establish a structured routine, use simple and clear communication, assist with activities of daily living while promoting independence, provide orientation and supportive environment. Now, let's talk about developmental disorder. So again, this type of disorder occurs or begins during childhood and which affects learning, behavior, and intellectual functioning. So, we have different types of developmental disorders. We have intellectual disability. We have your attention deficit hyperactivity disorder. So for your intellectual disability, or formerly known as your mental retardation, this is characterized by limitations in intellectual functioning and adaptive behavior. While your attention deficit hyperactivity disorder, this is characterized by inattention, hyperactivity, and impulsive. So this type of children experience, or those children who has this kind of disease or disorder, experiences or has lack of attention span. Very short yung kanilang attention span. For clinical manifestations, developmental disorders are characterized by delays or impairments in physical, cognitive, communication, and social functioning, usually beginning in childhood. Cognitive and learning may include delayed intellectual functioning, difficulty with attention and concentration, poor problem-solving skills, learning disabilities, delayed speech and language development, difficulty understanding or expressing language, and limited vocabulary or non-verbal communication. For social and behavioral, they have poor social interaction, so they have limited eye contact, difficulty forming relationships, repetitive behavior such as hand flapping or routines, hyperactivity or impulsivity, and especially for ADHD patients, emotional dysregulation, so nagkakaroon ng experience ng tantrums or irritability, and then motor adaptive skills, we have delayed motor development such as fine or gross motor skills, difficulty performing activities of daily living, and poor coordination. So what are the management for developmental disorders? So pharmacologic therapy may include stimulants for ADHD, antipsychotics for aggression and severe behavioral issues, and antidepressants for anxiety and mood symptoms. For behavioral therapy, we have applied behavioral analysis or your behavior modification programs. For speech and language therapy, this improves communication skills. Occupational and physical therapy, we have special education programs. So for nursing management, promote structured and consistent environment, enhance communication skills, encourage social interaction and play, support family and caregiver education, and ensure safety and monitor behavior, especially in the hyperactive state of patient who has ADHD. So you have to prevent injury. So next, let's talk about substance-related disorder or substance use-related disorder. So this type of disorder involves compulsive use of substances despite harmful consequences. So this may involve misuse or dependence on substances affecting the brain. So what are the different types of substance use disorder? So we have your alcohol use disorder, we have your opioid use disorder, stimulant use disorder, we have cannabis use disorder. So these are different common substances that may be used or misused by other people and may experience substance use disorder. So we have alcohol use. This is dependence on alcohol leading to impaired control over drinking. For opioid use, this dependence on opioids such as heroin or prescription pain medication. That is why that is important, very, very important, and pain assessment, that you have to really identify what type of pain does the patient experience. If it's mild, moderate, and severe, and you have to follow the WHO analgesic ladder before you go to, or before you prescribe medications with, or before giving medications in, or opioid medications, you have to at least try the other non-opioid medications to manage the pain of the patient, and avoid stopping the medication abruptly because the patient may experience withdrawal symptoms. So to avoid that, you have to completely assess the patient's pain. Now, another stimulant use disorders such as substances, the cocaine and methamphetamine. So the effects, this may increase energy, paranoia, and insomnia. For cannabis or marijuana, it is dependence on marijuana leading to impaired functioning. However, marijuana actually is a medicinal plant. If it's used for medicine or in limited amount, then it can actually improve the mood, or it can improve the functioning or mental functioning of a person. However, if it's not used regularly and properly, then it may impair the brain function. Okay, what are the clinical manifestations of people or patients who are using substance? Okay, or who experience substance use disorders. So we have strong cravings or urge to use the substance, loss of control over use, or inability to cut down, continued use despite harmful consequences, neglect of responsibilities such as work, okay, and school and family, social withdrawal or even risky behaviors, irritability, mood swings, or depression. So physical signs may include tolerance, so which they need for increased amounts, withdrawal symptoms when stopping the substance, sleep disturbances, changes in appetite and weight, and poor hygiene and physical appearance. For the substance-specific withdrawal symptoms, for alcohol, they may experience, if they are in the withdrawal symptoms may include tremors, sweating, seizures, or delirium tremens. Okay? For opioids, muscle aches, diarrhea, lacrimation, or yawning. For stimulants, such as your cocaines and methamphetamine, we have fatigue, depression, and increased appetites. For sedatives, they have anxiety, insomnia, or seizures. So what are the medical management? So first is your detoxification. You have to, especially for those patients who experiences withdrawal, you have to remove this substance in their body. So safe removal of the substance under medical supervision. Use of medications to manage withdrawal symptoms. We have also medication-assisted treatment such as giving methadone or buprenorphine for opioid dependence. We have naltrexone for reduced cravings, such for alcohol and opioids, and then disulfiram for alcohol dependence. For pharmacologic symptom control, we have your benzodiazepines or diazepines for alcohol withdrawal. We have antidepressants for coexisting. Again, if the patient also experiences depression or anxiety, then you can give antidepressants. For psychotherapy, they may undergo cognitive behavior therapy or motivational interviewing. They may They may undergo rehabilitation programs such as inpatient or outpatient substance abuse treatment or support groups, such as we have 12-step support programs. Now, for nursing management, monitor for any withdrawal symptoms and complications. So, assess the vital signs and LOC of the patient. Watch for any seizures or delirium, especially for those patients who has alcohol use substance abuse. Okay, we have ensure patient safety, establishing seizure precautions and safety precautions. We have established therapeutic relationship, promote coping strategies and relapse prevention, and provide health education. So the effects of substance use on health and importance of adherence to treatment programs. Now, let's talk about the somatoform disorders. Second to the last na classifications of mental illnesses. Now, somatoform disorders are characterized by physical symptoms that cannot be fully explained by a medical condition because there is no medical cause of that physical symptoms. Characterized by physical symptoms without a clear medical cause. So, example of this somatoform disorder is your conversion disorder, wherein there is a psychological stress that appears as physical symptoms such as paralysis, blindness, or seizures. So, example, a patient suddenly becomes unable to walk after experiencing a severe emotional trauma, but medical test shows no neurological damage, or after experiencing a something what do you call this, a trauma or emotional trauma, then the patient may have experienced amnesia. Okay, so this may support convert, or this is actually an example of conversion disorder. So anything that the patient can experience, physical symptoms, psychological symptoms that has no medical cause, is her conversion disorder. So what are the clinical manifestations? Again, this is characterized by neurological symptoms that cannot be explained by medical or neurological conditions, often associated with psychological stress. So motor symptoms may include motor paralysis or weakness, abnormal gait or coordination problems, tremors, or even seizures. For sensory symptoms, they may experience blindness or visual disturbances, deafness or hearing loss, loss of sensation or anesthesia, or tingling or numbness sensation. For speech sensation or speech symptoms, they may experience aphonia or loss of voice, or dysphonia or difficulty of speaking. Other key features may include appear suddenly after symptoms appear suddenly after stress or trauma, such as labile indifference or apparent lack of concern about symptoms. Symptoms are not intentionally produced, unlike malingering or factitious disorders, and inconsistency with neurological patterns. So, what are the medical management for people who are experiencing conversion disorder? Now, psychotherapy is the primary treatment. Cognitive behavioral therapy, which helps identify and manage underlying stressors. Treatment of underlying psychological issues such as addressing the anxiety, depression, or trauma. Because again, this type of disorder may be caused by psychological stress or trauma. Physical therapy, which helps restore normal movement and function. Pharmacologic management, if needed, you can give antidepressant for patient who experiences comorbid conditions or depression. Reassurance and education, explaining that the symptoms are real but not due to any structural diseases. Now, for nursing management, establish a therapeutic non-judgmental relationship, encourage expression of feelings, avoid reinforcing symptoms, promote independence and normal functioning, and provide positive reinforcement for healthy behaviors. So now, we're down to the last type of mental, or last classification of mental illness or disorder, the sexual and gender disorders. Again, this type of disorders involve disturbances in sexual desire, sexual performance, or sexual behavior. So, what are the different types? So we have sexual dysfunction, gender identity disorders, and paraphilias. So your sexual dysfunction may include problems such as erectile dysfunction. So this is for males, no? Their inability to erect their private part. And then premature ejaculation, wherein in sexual when we talk about sex cycle, there are stages of cycle of sex. Now, by the time that the patient hit the climax early, that is your premature ejaculation. And for female, sexual arousal disorder. Now, for your gender identity disorder or gender dysphoria, this is a actually in real world right now in the modern days that we have right now. This is a big issue, no? The LGBTQ plus community actually um this I cannot really put any ideas about this. Yes, we respect them as human beings. Yes, we respect them as a member of society. However, there are these certain lines that they are crossing right now that becomes an issue in the world that we have right now. So it's a big we call this we really have to respect their boundaries and respect them. And as I, even though we have different perception about this one, we don't have to be judgmental about this. Now, this patient who experienced gender dysphoria, this occurs when a person experiences distress due to mismatch between assigned gender and gender identity. So, in which they don't believe that they were born as male or they were born as female. So, gender dysphoria. So, this is a mental disorder. Okay? It's not how they were born. It's how they perceive themselves to be. Okay? And that is actually a mental disorder. Okay? And then paraphilias, sexual behaviors involving unusual objects or activities or situations. So, paraphilias, example, they're aroused and having sex with animals, okay, or having sex with the presence of stool, okay, or using any, what they call this, material or objects, okay, that could cause or inflict pain to other, they call this, they like to they like to have sex with a dead person or near the dead person. So there are different types of paraphilias. Okay, so what are the clinical manifestations? So these disorders involves disturbances in sexual functioning, sexual preferences, or gender identity, causing significant distress or impairment. So this sexual dysfunctions may include decreased or absent sexual desire or low libido, difficulty with arousals, such as those patients who experience erectile disorders or lack of lubrication. Orgasmic disorders, they experience delayed, absent, or premature orgasm, and sexual pain disorders such as dyspareunia or vaginismus. So paraphilic disorders, these are recurrent intense sexual urges or behaviors involving atypical objects or situations, distress or impairment due to these urges, and possible risk of harm to self or others. Gender dysphoria, they may experience a strong discomfort or distress with assigned sex at birth, desire to be treated as another gender, preference for roles, clothing, or identity of another gender, and emotional distress, anxiety, or depression related to identity conflict. For psychological and social features, they have low self-esteem, they have anxiety, or they may experience anxiety or depression, relationship difficulties, and social withdrawal or stigma-related distress. Now, what are the medical management for people who are experiencing this type of sexual and gender disorders? So, psychotherapy is a primary treatment. Cognitive behavioral therapy or sex therapy or counseling. Pharmacologic treatment may be prescribed if example, patients who are experiencing erectile dysfunctions, they have to give medications for that, or antidepressants or anxiolytics for controlling, or for patient who has comorbids such as depression or anxiety. Now, hormone therapy for gender dysphoria, especially for estrogen or testosterone to support gender transition. But again, not all are very supportive, no? Depending on the state or depending on the country that we have. or that we are living right now. And then for your gender affirming interventions such as social transition or surgical options. So again, if it's desired by the patient and if it's allowed and the body can tolerate those transitions, then okay. But if not, then we don't have to advise the patient to do the transition or surgical transition. For couples or family therapy, improve communication and relationship support. Now, for the nursing management, we have provided non-judgmental and supportive environment, use therapeutic communication, promote education and awareness, support coping and self-esteem, and ensure privacy and maintain professional boundaries. So, in summary, okay, mental disorders affect mood, cognition, behavior, and social functioning. Thus, the nurses must be able to recognize the symptoms of mental disorders, to provide therapeutic communications, to ensure patient safety, and to support treatment and recovery. By understanding these disorders, their characteristics, it allows us nurses to deliver holistic and compassionate psychiatric care. So that would be all for this Unit 3, Mental Disorders or Mental Illnesses. Thank you for watching. If you have questions, clarifications regarding the topics that I have discussed, please do not hesitate to comment below on my YouTube channel or beat me up through message. Okay, so thank you once again and Assalamualaikum warahmatullahi ta'ala wabarakatuh.